Welcome to today's lecture on the fascinating topic of ion channels in neuropharmacology. In this lecture, we will delve into the intricate world of ion channels and their role in neuronal signaling and pharmacological interventions. Ion channels are fundamental to the function of excitable cells, such as neurons, and play a crucial role in maintaining the electric potential across the cell membrane. By understanding the mechanisms of ion channel modulation, we can gain insights into the development of novel therapeutic agents for the treatment of various neurological disorders. So, let's begin our journey into the intriguing world of ion channels. In this section, we will explore the importance of ion channels in neuropharmacology. Ion channels are proteins that control the movement of specific ions across cell membranes. Understanding their physiology is key to understanding drug effects on neuronal activity and synaptic transmission. This video will discuss neurotransmitter-gated ion channels, which are involved in neuropharmacology. These channels respond to neurotransmitters released in the synaptic cleft and can influence synaptic transmission. Drugs targeting these channels can modulate neuronal activity and are used in various therapies, such as smoking cessation and anxiety disorders. In summary, voltage-gated sodium channels play a crucial role in neuronal excitability and action potential generation. Their opening and closing are regulated by changes in membrane potential. Pharmacological manipulation of these channels can be used to treat diseases like epilepsy and chronic pain. Sodium channel blockers inhibit their function, while activators can be used to dampen hyperexcitability in epilepsy. Voltage-gated calcium channels play a crucial role in various physiological processes. They can affect neurotransmitter release, synaptic plasticity, and muscle contraction. Different types of these channels exist, with specific properties and distribution in different tissues. Modulating calcium channels pharmacologically can have therapeutic benefits for conditions like hypertension and chronic pain. Certain drugs called calcium channel blockers can inhibit calcium influx, leading to vasodilation and reduced cardiac contractility. Manipulating calcium channel activity holds promise for developing treatments for neurological disorders like Alzheimer's and Huntington's disease. Voltage-gated potassium channels are important in neuropharmacology. They help in repolarizing the cell membrane and shaping action potentials. These channels consist of alpha subunits and auxiliary subunits. Manipulating them can affect neuronal excitability and synaptic transmission. Potassium channel openers like minoxidil treat hypertension, while certain toxins can disrupt neuronal function. Ligand-gated ion channels are key channels in neuropharmacology, activated by hormones or neurotransmitters. One important class is glutamate receptors, such as NMDARs, involved in learning and memory. Modulation of these receptors with drugs can improve treatment of neurological disorders by precisely modulating neuronal function. In this video section, we explore inwardly rectifying potassium channels, which play a crucial role in maintaining cellular stability. These channels allow potassium to flow into the cell, affecting membrane potential. Pharmacological agents that enhance these channels may have therapeutic implications for conditions like epilepsy. In this section, we will explore the fascinating world of two-pore domain potassium channels. These channels, also called leak channels, are crucial for maintaining the resting membrane potential and regulating potassium conductance in cells. They have a dual-pore structure that enhances their stability and modulates their activity. Two-pore domain potassium channels are found throughout the body and are involved in important processes such as cellular excitability, hormone secretion, and kidney function. Pharmacological manipulation of these channels holds promise for treating various disorders. For example, drugs that specifically target task 1 or task 3 two-pore domain potassium channels have shown potential in managing conditions like depression, sleep disorders, and certain types of cancer. The distinctive characteristics and widespread distribution of these channels make them attractive targets for future neuropharmacological interventions. In summary, chloride channels play a crucial role in maintaining cell volume and regulating neuronal excitability. Dysfunction in these channels is implicated in diseases such as cystic fibrosis and epilepsy. Targeting chloride channels with pharmacological interventions has shown promise in the development of therapies for these disorders. In the video on TRP channels as drug targets in neuropharmacology, we will explore the fascinating world of transient receptor potential, TRP, channels. These channels are crucial for sensory functions and have important roles in various physiological processes. Dysfunction of TRP channels is associated with diseases like chronic pain and cancer. Pharmacological modulation of TRP channels offers promising opportunities for therapeutic interventions, including the treatment of chronic pain and potentially targeting cancer cells. Moving on to a topic with significant clinical implications, we now explore hERG, human ether a-go-go related gene, channels and drug-induced QT prolongation. hERG channels are classified as voltage-gated potassium channels and play critical roles in cardiac repolarization. Prolongation of the QT interval on the electrocardiogram, ECG, is associated with an increased risk of potentially life-threatening arrhythmias, such as torsade de pointe. Many drugs, including antipsychotics, antibiotics, and antihistamines, can inadvertently block hERG channels, leading to delayed cardiac repolarization and QT prolongation. Understanding the mechanisms underlying drug-induced QT prolongation is crucial for mitigating the associated risks. Pharmacologists strive to identify potential QT prolonging drugs early in the development process and design strategies to minimize their adverse effects on cardiac repolarization. In the last section of this video, we will discuss the challenges and future directions in modulating ion channels for neuropharmacology. Selective targeting of specific ion channels and overcoming limitations in drug delivery and efficacy are ongoing research goals. Advancements in drug discovery techniques and gene/cell therapies offer promising prospects. In conclusion, ion channels are key players in neuropharmacology, controlling how neurons communicate and influencing various bodily functions. By understanding how drugs interact with these channels, new treatments can be developed with fewer side effects, improving patient outcomes for neurological disorders. Ongoing research in this area offers promising possibilities for future advancements in drug therapies.